I think a lot of times when people come in already on medications, there are several issues. One is that the medication they're on is not working, and I'll get back to that in just a minute. That's not uncommon at all. Secondly, the person may be taking the medication, but we see that there are a number of other issues that really need to be explored, that the medication alone is not going to deal with the whole issue. And while talking with them, of course, we need to be very tactful and sensitive and professionally appropriate about the way we interact with a fellow colleague, whether it's a psychiatrist or it's a primary care doctor. And so let me just mention the first thing, because this is so common, and many of your people attending this webinar are going to say, yeah, I've been there many times before. Person comes in and they've been given an antidepressant by their primary care doctor. The most common reasons that the drug is not working is, number one, is that the person is not taking it. And I mean, it sounds like I'm stating the obvious, but people have lots of worries and fears. And I understand this. People are afraid of, gosh, is this addictive? Or they've heard reports on TV about antidepressants potentially increasing suicide in certain individuals. And in primary care, in the 15-minute session with their doctor, even if the physician's very good about trying to talk about the issues, there's not enough time to really talk about that. And so people walk away from that, and they're just afraid. And sometimes they don't even tell the doctor they're not taking the medicine because they don't want to be a bad patient, that sort of thing. So there it becomes very important for us. Let's say we agree that probably medications would be helpful. That's a time for the psychotherapist to say, let's really talk about not only your situation, but looking at the medication, your experiences, if you're having side effects, and so on and so forth, and open the door and not rush things. This is what's really different about primary care medicine is, therapists, we know that people have got to have a chance to really talk about something, not just be given information about, side effects and that kind of stuff, but for us to really hear what their concerns are. So that's one issue, and it may lead to us needing to consult with the primary care doctor, about the medication.